Hello, my name is Justin Lewis. I'm here to talk about myotonic muscular dystrophy. Myotonic muscular dystrophy is the name for a group of inherited disorders where muscle tissue and muscle bulk gradually decline as the person with the disorder ages. It can affect multiple parts of the body and the internal functions. As Johns Hopkins Medicine says, that it is a multi-system disorder that affects the skeletal muscles, smooth muscles, and the heart. It can also impact the brain, as you can see in this little diagram here. The cognitive impairment is evident in many patients. It is also inherited pretty evenly between male and female. There are many different symptoms of myotonic muscular dystrophy, which include all of these, as Johns Hopkins medicine described: the gastrointestinal disturbance, the arrhythmia, where it affects the heart, as well as the myotonic muscular dystrophy. It is also just a subsect of the general term of muscular dystrophy. Muscular dystrophy is a group for those kinds of disorders which your muscle tissue and muscle bulk gradually decline. But myotonic is the kind of muscular dystrophy that affects with all of these symptoms. The effects on the communities, we see that around 1 in 8,000 people have myotonic muscular dystrophy in the world, which, to put that into perspective, about 1 in 500 or so people have cancer. So it's not very common that people get myotonic muscular dystrophy, but that being said, with it being an inherited disorder, it is actually likely, if somebody has the disorder, that their offspring will more than likely have the disorder as well. The Myotonic Dystrophy Foundation, a very reliable source on this disorder, they state that millions of people are living with myotonic dystrophy, and yet they have no idea that they actually are living with it and that they do need care. Treatment and support for myotonic muscular dystrophy. If you are ever scheduled for an appointment with a neurologist, they might recommend a prescription of a drug called meselatine, which is an antiarrhythmic, which, once again, myotonic muscular dystrophy affects the heart, antiarrhythmic being fighting against that. The Myotonic Dystrophy Foundation, once again, a very reliable source and a great resource to find more information on this topic and to see if you actually do need to be treated. You can visit their website, and they have plenty of resources and help to support you or a loved one who has myotonic muscular dystrophy, as well as Johns Hopkins Medicine as having a whole lot of resources for patients who need treatment, or if you just really want to know your diagnosis, if you have myotonic muscular dystrophy or not. You can call any one of these numbers depending on what category you fall in, whereas if you're an international patient or outside of Maryland, all those numbers can also be found on the Johns Hopkins Myotonic Muscular Dystrophy website. Yes, this disorder is very uncommon, but that doesn't mean it's not a problem. And there used to be a fundraiser. I think the Myotonic Dystrophy Foundation had it, but there used to be a fundraiser for myotonic muscular dystrophy, um, and you could donate money there. You could still donate money, I believe, as you can donate to many places, even if there is no fundraiser. You can always donate to help and support people with MMD. And all right, that is all I have for you today. And these are also some other resources if you would like to dive into this topic yourself. Once again, these are the resources that I've used. And that is all. Thank you.